We will perform an injection at the patient's zygomatic arch and the beautification point during this stage. We will try to lift the patient's face a bit more. There's a key drawing point for this injection. The text describes the intersection of the mouth's corner, the end of the orbiter, and the area extending from the nose wing to the tragus. It has been determined that the most prominent point of the zygomatic arch should ideally be located where the light gracefully falls on the faces of world-famous stars or individuals widely recognized for their exceptional facial beauty and attractiveness. This is a beautification point. If this is a male patient, this specific point would be precisely where the imaginary line descending from the outer edge of the black part of his eye intersects with the corner of his mouth. We would have been achieving a more pronounced square face shape for the male patient. We are trying to achieve a triangular face shape that is a bit higher for the female patient. When you carefully combine the distance measured between the arch of the cheekbone, known as the zygomatic arch, and the chin point with the distance leading to the designated beautification point, it produces a visually striking diamond-shaped appearance, ultimately resulting in a pleasing elliptical look. This elliptical appearance is the structure that creates attractive features for a woman's face. In male patients, on the contrary, we lower the mandibular angle a bit more, bringing it down to the 90-100 degree range for a more masculine appearance. In other words, you are trying to widen this area to achieve a more masculine look, aiming for a broader and thicker jaw. We strive for the jawline and highlighter lines on women's faces to run perfectly parallel for a balanced look. One of the biggest mistakes made here is that after the injection at this point, the injection continues along the zygomatic arch, meaning that this area is being elevated. When you elevate this area, yes, you achieve a much more beautiful recovery in this plan, but when you widen the face this way, it leads to a more masculine appearance. Therefore, for female patients, it is essential to create a defined sharpness in this area by performing a superficial injection after executing a deeper injection at this specific point. This technique aims to establish a prominent highlighter line that runs parallel to the jawline, enhancing the overall facial contour and providing a more sculpted appearance. We'll begin our application with some cleaning. Yes, we will perform a procedure using a cannulated technique. The widest point on the patient's face related to a previous injection is shown in this plan, friends. Therefore, the structure that goes forward from here at the narrowest point. If I can bring the important aspect of beautification a bit more to the forefront, this particular structure will appear slightly wider and taller than before. Therefore, the face will descend a bit more strongly instead of suddenly becoming triangular and weakly going down. We will reveal the elliptical face shape of the woman with a more square appearance from the back and a more triangular one from the front. Therefore, we don't need to emphasize this area too much in this patient. But this area can be slightly elevated. I will make an entry slightly more towards the front of the zygomatic arch, but also just behind the ligament for better access. I am placing my cannula. I must adhere to the plan for the bone structure, everyone. I perform this maneuver with my hand to lift the subcutaneous fat tissue. I also lift the muscle tissue. I attempted to advance the process of cannula in parallel along the bone, targeting the deepest underlying structure. At this moment, as you can clearly see, when I gently move it, I'm situated just beneath the skin, specifically underneath the fat tissue from this point onward. I am beneath the skin and above the bone tissue here. I can't see the tip when I try to project the cannula in any way. The plan to follow is based on the bone structure. If you choose to remain on the surface here, envision it like the delicate glasses carefully positioned on the tray. Whenever the tray moves, the glasses also move, and consequently, the fragile glasses may break or fall depending on that movement. If you place filler on the surface here, it will move back and forth with every smile of the patient, contributing to dynamic movement and consequently leading to an undesirable appearance in the patient's facial expressions. If you place it on the bone, the tension will increase due to the muscle tissue projecting slightly upward as the muscle or fat tissue remains above the dermal filler. The face will appear tighter while remaining free from facial movements. So we will actually have a bony appearance. I'm starting my injection now. I'm searching for a line I don't want to cross, feeling it out. I place my needle on the tip of my finger in that deep plan. And I want this specific point to be projected approximately upwards into the air. At this point, I will use a product between 0.3 and 0.5, but I need to ensure that I do not apply more than 0.3 to any one area so that my product can be easily absorbed into the tissue. Yes, I continue my 0.5 injection in that area with left and right movements, but I could also stop at 0.4. I determine my quantity by looking at how it takes shape based on my instinctive actions. Looking down on the patient from above is an extremely important detail in this regard. If I gently and carefully turn the patient to the side like this, I have started to gradually obtain the desired projection at this specific point. I gently turn my face back to the front, forward. Look, I have created a thinning line in this area. I have now successfully achieved a more feminine transition by gently applying a very light pressure to the protruding point located here. We are continuing with the process. Guiding needle again. This time I will enhance this point a bit more with a small injection just behind the highlighter line in my patient. So which specific layer am I in this time, friends? I am right above the subcutaneous fat tissue. I am at the most superficial layer possible. I don't want to go deep. My aim here is to create a fine line, a highlighter line in this way. I will use approximately 0.1 products here as well. Since the volumetric effect of the product I used is quite nice, I was able to easily achieve the desired look in this area with just 0.5 total product. The presence of 30 million of hyaluronic acid is beneficial for me. I want to gently bring the patient's face into a sitting position now. Observe the noticeable thinning and sharpening of the facial features in this specific area, as well as the clear definition of the shadow throughout this entire region. We observe that this side is both narrower and has a lift upwards. The filling we applied had a significant impact on the temporal area. We have now stabilized our head and turned the patient's head to the side. Supporting this point gently in front of the patient's ear while carefully adjusting helps to pull the face further back. What are our actions? We are trying to mimic the procedures in facelift surgery at one point. We are trying to create a depression in this part of the face by pulling the excess skin inward, forming a frame on the outer side. We picked up our needle once more. We need to be positioned approximately a finger's width in front of the ear for optimal placement. We carefully made a small incision at this precise point. We are not in a deep layer here, friends. The work we will do here is just above the subcutaneous fat tissue. I need to go deeper here. Therefore, I am trying to reach the desired level with slow movements. I am moving forward now. I am located above the fat tissue. Look, I'm on a plan where I can move comfortably again, but I'm on top of the fat tissue. I will also be using my approximately 0.5 product in this area in a bar-like manner from top to bottom. I'm injecting in this area using the fan technique, friends, especially in patients with pronounced hollows in the preauricular area. The improvements we make, which may require the use of up to 1 milliliter of filler, will be extremely effective. The only critical point here is that if the patient's skin quality is not that tight, you need to use 20 mg of hyaluronic acid instead of 30. We are using the 30 milligram form of Gloderm here. Because the patient's skin tightness is quite good, we wanted to take advantage of the maximum projection and tension effect of the filler we applied. If you pay attention, we have created an angle like this at this point,